What are the best exercises for rotator cuff strengthening? Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain some of the common myths and misconceptions about exercises for rotator cuff strengthening and some of the best exercises, in my opinion, to help strengthen your rotator cuff if you do have shoulder pain. So, what are the most common exercises for rotator cuff strengthening? Well, after years of experience in the physical therapy industry, the most common exercises for rotator cuff strengthening involve using rubber tubing or a TheraBand or some sort of resistance band and going outwards like this to strengthen your external rotators, or turning inwards like this to strengthen your internal rotators. And those do strengthen your rotator cuff, but probably not in the ways that are going to be most effective to people who actually have shoulder pain and want to relieve their shoulder pain during functional activities. So let's first take a look at this exercise and break down some common problems that people experience when they're doing this exercise. So when most people do this exercise, they go out like this quickly with their shoulder. Now, first of all, you want to slow down the speed of motion. This isn't an exercise that you just want to go back and forth like this. The primary reason of that being, if you go fast, if you watch this shoulder blade, when you go back and forth like that, you don't want it to be a lot of shoulder blade movement going this way. That uses primarily your rhomboids, which with most people with shoulder pain, the rhomboids are overactive anyway. And so you don't want to use your rhomboids when your goal is to strengthen the rotator cuff. So when you're doing this exercise, you want to go at a slow, controlled speed. Imagine a ball sitting on a tee, like a golf ball sitting on a golf tee. And you just want to rotate that ball in the center of the tee. So the tee faces out this way, and you just want to rotate smoothly back and forth in a slow, controlled manner. Now you'll notice that the range of motion is significantly less when doing it this way versus going back and forth that way. So you want to ramp down your range of motion, ramp down your speed, and go at a slow, controlled speed just through the range that you can, just moving as if there's a rod or an axle running through here, and you're just trying to spin around the arm bone like this. So that's the shoulder external rotation. Now I will give you one other tip. Take a towel and roll it up in a log like this. Now the reason you do this is that the normal anatomical plane of your shoulder, it's not right out to your side, and when your elbow's right down by your side, it takes the rotator cuff and it stretches it over top of the shoulder. And it brings the most commonly torn rotator cuff tendon, the supraspinatus. It stretches it tight over the shoulder. So you actually want to get a little bit of slack in the shoulder. It brings your elbow away from your body, and it puts it more in the resting anatomical plane, the way that your shoulder joint is designed, that your shoulder blade doesn't sit flat on your trunk. It actually sits a little bit forward. And so the resting position of your shoulder is a little bit more like this. So this will put your shoulder in the resting position. And then again, slow, controlled movement. It's not a huge range of motion because you're just using very tiny muscles to your rotator cuff muscles to produce this movement. It's not a big movement using your shoulder blade. So that's the most common mistake that I see with rotator cuff strengthening for the shoulder external rotators. And just to break that down, that's the supraspinatus, infraspinatus, and teres minor. All of those muscles are on the back of the shoulder blade, and they're 3 of the 4 rotator cuff muscles. Now, the other common rotator cuff strengthening exercise that people use is to strengthen the 4th rotator cuff muscle, which is your subscapularis. The subscapularis sits underneath the shoulder blade on the front side of the shoulder blade. So it's between your rib cage and your shoulder blade. And because of that, people don't think about it that commonly because it's hidden. It's really kind of hard to touch, but a lot of people do have trigger points there. So when I treat people clinically with some manual therapy techniques, I do actually often get underneath the shoulder blade to work on that subscapularis, because a lot of people do have trigger points in that subscapularis. And dry needling the subscapularis is also a fairly effective treatment because it's hard to get your fingers down in there, and sometimes you can get a needle there a little bit easier. But to strengthen your subscapularis, the typical way that people do that is, again, doing a shoulder internal rotation exercise. And if you look at the way that people normally do it, there's usually a lot of excessive motion. It's usually way too quick. The elbow often moves, and that shouldn't be the case because, again, you want to rotate around an axle running through your arm bone. So the elbow should be stationary and just rotating around the arm like that. Again, it kind of helps to use a towel there to put the shoulder in the normal anatomical position, but also sort of to stabilize your elbow so that it's not moving. And it's a much slower and controlled motion like that. Now, again, if you look at the way that most people normally do this, we're going to look at this shoulder blade now. Most people come across their body, which is actually kind of an adduction or a movement of their shoulder blade, where the shoulder blade is coming on and off of the trunk. And again, that's not a great problem because a lot of people have problems stabilizing their shoulder blade. And so you want to get the shoulder blade stabilized. If you look from the back view, towel underneath the elbow and rotating in that way. So the shoulder blade should be pretty still. Most of the motion is just coming from the arm, and the elbow shouldn't move a whole lot. So those are the correct ways to perform the most common rotator cuff strengthening exercises. But again, I don't think those are maybe necessarily the best rotator cuff exercises. If you look at studies, they do produce a lot of EMG activation of the rotator cuffs, which means electromyography. And basically that's an electronic study that measures how much that muscle activates. And they are really good exercises for activating the rotator cuff muscles, but it doesn't necessarily translate into better function. Why is that? Because most of the time we don't use our rotator cuff in this sort of manner. This isn't a movement that we do in everyday life. So when do people typically have problems with their rotator cuff? Well, typically people who have rotator cuff pain, they have problems when they're reaching above shoulder blade, or when they're throwing things, or when they're doing things with their arm reaching out to the side. They're doing things usually in a plane that's above 90 degrees, or where their elbow is above their shoulder. And so doing an exercise where you're rotating like this with your elbow at your side really doesn't do a whole lot of good if most of your functional problems are when your arm's up here. And so in order to do that, you really want to do exercises that strengthen your rotator cuff with your arm above your shoulder. Now, the other thing to keep in mind is that your rotator cuff really has two functions. Its primary mover function, where it's actually to move your arm, is in that rotation, or in that rotation like this. But its secondary function is actually to stabilize the shoulder as you're moving your arm. So I mentioned, again, like a golf ball sitting on a golf tee, that your shoulder should move where that ball is centered on the tee, and it stays centered in the socket. And that's really the primary function of your rotator cuff when you use it in everyday life, is to hold that ball centered in the tee as you use your bigger, stronger shoulder muscles like your deltoids to move the arm. And if you didn't have a rotator cuff, or if you've torn your rotator cuff, the deltoid will kind of take over and pull the ball up high in the socket. And that's not good because it pinches your rotator cuff tendons or pinches other structures like the bursa that sit underneath of your shoulder. And so you really need to use those rotator cuff muscles in functional purposes to suck that ball into the socket and keep it from riding up in the socket or keep it from riding forward in the socket, so that it moves as smoothly as possible as you're reaching up to reach things, or lifting things overhead, or throwing a ball, or swimming. various other things that you do with your shoulder. You use your rotator cuff to stabilize the shoulder rather than to move the shoulder most of the time. So how do you strengthen the rotator cuff in its stabilizer function? Well, largely it's just to use it the way that you would use it in everyday life or in your functional activities or sports activities that you want to be able to do. So if you have trouble reaching over your head, the first thing just to do, even without weight, is to try raising your arms up and imagine keeping the ball centered in the socket like this. Now you can do that going out to the side like this, and you don't want to allow the shoulder to shrug up excessively, although your shoulder blade should rotate up like this. So it's not exclusively an arm movement, but you do want to keep the ball centered in the socket, going up as high as you can without producing shoulder pain if you do have some. And you can do this freestanding. You can also do it standing with your back up against a wall. Now, the tendency, if you just let your arms fall towards gravity, is to go into internal rotation here. And so you're actually using your external rotators of your shoulder to keep your arms pulled back like that. Now that's important because it takes the ball of the shoulder and it moves it in such a position where you're not pinching your rotator cuff tendons. Additionally, it helps hold the ball down in the socket as you're raising your arm up so you don't pinch the tendons as you're raising your arm up. Again, you want to go into external rotation, which is what your rotator cuff muscles, or at least 3 of them, do. And then raise your arms up, going as high as you can comfortably, and then coming back down. Now I can go all the way up this way, but I do lose control a little bit. My arms fall into internal rotation. So if I'm trying to purely maintain external rotation or standing with my back up against a wall here with fingers touching, that's about it. Again, I can go up there and that doesn't hurt me, but to maintain perfect form with this exercise, standing back to wall, sliding the arms up, sliding the arms down, sliding the arms up, sliding the arms down. So again, notice like with the rotation exercise like this, it's a lot more about control, not necessarily a huge range of motion with the exercise. Now you can do that same sort of thing, raising your arm to the side and thinking about keeping that ball centered in the socket, going up, then going down, or sliding up, sliding down, sliding up, sliding down. With your back to a wall, we're looking at it from a front view. If you keep your forearms parallel like this, again, shoulder external rotation, not allowing your elbows to drift outwards and your fingers inwards, which is internal rotation. You want to go into external rotation. And again, that helps clear the bump that's likely to pinch the rotator cuff tendons. Go into external rotation here, forearms parallel like railroad tracks, keeping the elbows pinched in and fingers flared out. You don't want to allow your arms to go that way. And again, if I let my elbows flare, I can go a lot higher, but if you keep your forearms parallel, that's about it. That also kind of helps stretch your lat muscles, which a lot of people with shoulder pain, they do have stiff lat muscles as well. And going this way helps stretch your chest muscles or your pectoral muscles. And a lot of people with shoulder pain have stiff chest or pectoral muscles as well. Now, if that gets too easy, you can always add weight to it. And doing shoulder presses is a great exercise for shoulder pain, but you only want to use as much weight as you can comfortably. And again, it's kind of that same exact technique as you were doing there before. Now, you may or may not be able to see from camera angle, but my arms are kind of back that way a little bit. And the weight of the dumbbells actually kind of helps hold you in external rotation as you raise the arms up and then come back down that way. So those are the functional rotator cuff strengthening exercises. But what if you're a swimmer or a thrower or someone who does this sort of movement where you actually are using that rotational part of your rotator cuff? Now, when you're throwing a ball, you don't really use the rotator cuff so much to generate the force because they are very tiny muscles. You use the bigger muscles actually starting all the way down in your glutes, pushing off with your leg, translating that through your body, rotating your trunk, and then finally using your shoulder at the very end range. but you do use your rotator cuff muscles to slow down, particularly on your follow through. And that's where a lot of throwing injuries happen, for example, in pitchers, not so much on the throwing phase, but on the slowing down phase, as they're using the rotator cuff muscles to decelerate or slow down the arm after they've released the ball. And so to do that, you can just do arm rotation like this, where again, you're trying to keep your elbow fairly stationary and just practice on rotating around an axle going through your arm bone, going into external rotation, and internal rotation, and external rotation, and internal rotation. Now, to increase the difficulty of this, force equals mass times acceleration. So you can add more weight by using a dumbbell. But when you're using this rotation to, say, throw a ball, for example, or spike a volleyball, it's really more about velocity. And again, force equals mass times acceleration. So the more acceleration, or the faster you go, while still trying to keep the elbow stationary, also helps increase the force without adding any weight. And it's more functional the way that you actually use your arm in sports performance. Now you can do that with a band as well. And I mentioned I'm not a huge fan of using the band down at your side, but using it up above shoulder level, where you're going back and forth like that. And again, you want to use a resistance that you can go reasonably quickly, but still have control. You can start out at a slower resistance, and then over time, kind of increasing that resistance or increasing that speed. This band is pretty stiff to go at that fast speed, but that's the way that you would use a band to strengthen your rotator cuff muscles above shoulder level. So those are my recommendations for exercises to strengthen your rotator cuff. Now, if you do need some help for shoulder pain and you happen to be in St. Louis, we'd be happy to help you out at my clinic, More for Life. But if you're watching this video from somewhere else and you found it useful and it gives you some more guidance on the best exercises for you to use to strengthen your rotator cuff, give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.